everyone, welcome back to my YouTube channel. I'm really excited. I feel like I say that every week, I need a new line, but I'm genuinely just an excitable person. I have got my superstar periodontist here, and for those of you that don't know, this is Dr Mitul Shah. He is a specialist, and I did a video about what the differences were between general dentists, cosmetic dentists, and specialists. And so, in short, that summary of that video explained that specialists go back to university for a number of years, and they actually study even more and more number of years to become on the specialist registrar. I would say that about 7 out of 10 of my cases go and see Mitul first, and that's to treat usually recession, gummy smiles, and lots of other aesthetic features. But one thing that we don't talk about often enough is the health side of things. So I'm going to get Mitul to do an introduction in a minute, and I'm going to quiz him on how gums and our general health are interlinked and affected. Please don't forget to subscribe and like to the channel, as I always ask you guys to do. But without further ado, dun dun dun, drum roll, this is Dr. Mitul Shah.
Hi, so I'm Mitul. I am a specialist in periodontics, which is basically the strange subject of gums. I graduated in 2012, so I think slightly after you.
I'm old, just an FYI. If I think I'm young, I am old.
She's not old. She's going to dock my wages, but that's fine. I graduated in 2012. I worked in hospital for a bit, went into practice. And unlike Rhona, who maybe had a clearer idea of what she wanted to do, I was a bit conflicted. I was very good at surgery, but the surgical pathways to become a maxillofacial surgeon probably would take sort of 20 years, and my wife wouldn't allow that. She wanted to get married and have kids. So I had to kind of sit down like I was doing my UCAS application, think what I was good at, look at careers. Perio, gums stood out. I really like it because it's very multidisciplinary. I get to collaborate so much on cosmetic cases. I accept referrals from all sorts of clinicians. The impact that it makes to people in terms of their general health, aesthetics, is just amazing. So I feel like I've kind of...
Life-changing, guys, you can see it, and we're going to go into the aesthetics as well, but it is amazing.
Yes, I feel like I've gained these skills that not many people have, and we can really kind of elevate what we offer at Chelsea.
100%, it's the Chelsea look and the Chelsea gums that is trademarked. We only do it at Chelsea, but it's a certain type of look. What's been really interesting, particularly I think when the pandemic hit, was that people were really interested in health and the way in which you could improve your health and how we get sick and so forth, our immune systems as a whole. But what people don't really understand or appreciate, and I'm sure you agree with me, is that the mouth is the portal into the body, and people often think medicine is completely separate and a lot more complicated and neglect dentistry. But dentistry is a part of medicine. We're just specializing in the mouth effectively. So I'm going to talk about various different diseases that are directly linked to the gums that you guys probably didn't know about with Mitul, and quiz him on that. The first one being gums and diabetes, the second one being gums and heart disease, and the third one, which hasn't got as much research, is gums and COVID and what's going on about that. Without further ado, do you want to explain how diabetes and gums has a bi-directional relationship and how gum health is really important?
Yeah, so we all know that gum disease is a very prevalent condition. Approximately 80% of people above the age of 35 have some form of gum disease. Although it's a sort of smaller percentage of the population have diabetes, it has been shown over a number of years that there's a key sort of relationship between the two. To explain it in simple terms, essentially gum disease is an inflammatory condition, and the damage from diabetes is also inflammatory. So the idea is, if you have inflammation in the mouth, it is this portal that leads to systemic inflammation that can exacerbate diabetes. We know through research that patients who have gum disease are much more likely to be diabetic. We know that patients with gum disease are less likely to be able to control their diabetes. And equally, we know that people who maybe are newly diagnosed as being diabetic have a 3 times greater risk of having gum disease.
3 times, guys, 3 times. So that is a lot.
We all know that diabetes is, very common in the Western world with our lifestyles. In many ways, it shares common risks with gum disease. So being overweight, lack of exercise, just general, Western lifestyle, being sedentary. A lot of that is linked with gum disease as well. So it's been shown if you're obese, you have an increased risk of gum disease.
Do you think it's because of the diet that people then have gum disease, because in a way they're not looking after their, or do you think it's related to, how is that relationship linked, like obesity and gum disease?
Well, the obesity side of things is linked basically via inflammation. So when you're obese, your body has increased inflammation. Inflammation is the process of healing, but it's also the process of destruction. And so if you have increased systemic inflammation, you have more inflammation in the mouth, you get expression of molecules called cytokines, which are pro-inflammatory. Sorry, my Invisalign makes me not talk properly. And essentially, pro-inflammatory cytokines can lead to bone loss and damage of the gums. So it's this whole idea that if you're generally unwell, you're generally inflamed, it leads to problems in the mouth.
Interesting. And do you think, so if your gums are treated or you reduce the gum disease, how does that affect your diabetes, or does it not?
So treating gum disease has a profound impact on reducing your diabetes, and specifically reducing a measure known as the HbA1c. So this is the 3-month sort of measure of glycemia, how well controlled your blood sugar is. A recent study a couple of years ago, based in University College London, showed that actually performing periodontal treatment reduces the HbA1c, which is this measure of diabetic control, by 0.4%. Now, what does that mean? 0.4% is the same as taking medication that you would take for diabetes. So you're often prescribed something like metformin or gliclazide.
Yeah.
Just from treating your gums, it's the same as taking that medication.
That's powerful.
And in terms of the impact on the person, you know, it's a number at the end of the day, this arbitrary sort of measure. What does it mean? For every 1% you go up in HbA1c, your risk of dying from diabetes goes up by 21%.
Can we say that stat again?
So every percentage that you go up in HbA1c has a 21% increased risk of mortality and morbidity. Even a 0.4% reduction in HbA1c actually has a profound impact in improving your general health, reducing diabetic complications.
Oh my God, that's really fascinating. So I think this goes to show you the holistic approach to diseases and how it's all interlinked, how important it is. And gums are definitely neglected. So do think about seeing a specialist or, you know, a hygienist as well if you're worried about your gums at all, and they can kind of talk you through the various treatments on that. That's diabetes. Now what about heart disease?
So recently, probably in the last year, there was a huge study between the European Federation of Periodontology and the World Heart Foundation. We've known for about sort of probably 15, 20 years, there are associations between gum disease and heart diseases. Yeah. And that includes heart attack, stroke, hypertension, all these sort of things. But they actually collaborated and did a huge body of research to show if you have gum disease, your risk of all of those complications, heart attacks, stroke, really bad things that can affect your life, are much increased. I think I'm right in saying 1/3 of all deaths in the world are down to cardiovascular disease.
Wow.
And again, 800 million people in the world approximately have gum disease. So there's a lot of potential for crossover there. So you can kind of see as a sort of intervention in public health, actually just ensuring your gums are healthy, if it has any effect in reducing your exposure to cardiovascular disease, will have a big impact.
I actually didn't even know those statistics, to be honest. That's pretty shocking.
In terms of how it happens, how are the gums and the heart linked, we can't definitively say there's an exact cause. We know again that there are a number of associations between the two. So for example, heart disease, you're more likely to get it if you smoke. Smoking is one of the key risk factors for gum disease. Similar to diabetes, obesity, inactivity, having high blood pressure, all these sorts of things cross over. Being stressed. Stress and gum disease are sort of linked together as well.
Why would stress have an impact on gum disease or gum disease on stress, or etc.? I mean, how does that work?
So stress can have an effect in two ways.
Yeah.
One is through your behavior. So when we're stressed, we take different actions. So we may not look after ourselves as well as we should. We may not eat properly. We may not exercise. We may not sleep as much. We may actually turn to habits that are detrimental to our health. So people who are stressed might smoke or vape or drink alcohol. So that can have an indirect effect on your gums, as well as when people are stressed, maybe teeth are not the forefront of their thinking, not brushing as well. Actually, physiologically though, stress can lead to, again, pro-inflammatory sort of cytokines and molecules that can cause gum disease. That's
fascinating, and I think it brings me on to my third thing, which a lot of people are interested in, and obviously we don't have enough out there at the moment. But what about COVID?
COVID obviously is very new in terms of medicine, so it's only of March last year we really came to understand what it is. We know that COVID-19 is sort of characterized by huge inflammation that can manifest in a number of ways, but obviously inflammation of the lungs and all of the respiratory symptoms. But increasingly, there's been kind of an interest between the mouth and COVID. So a study in Qatar, I think earlier this year, may have been last year, which was a case-controlled study, looked at 568 patients who had COVID-19. They looked at people who were admitted to ICU, who were given assisted ventilation and who died, unfortunately, of COVID-19. And they cross-referenced their dental records as well to look at how much bone they'd lost around their teeth and to sort of diagnose if they had gum disease or not. And they basically found in this sort of pretty small study that your risk of dying of COVID-19 was 8 times greater if you had gum disease, and your risk of being ventilated or admitted to ICU was 3 to 4 times greater if you had gum disease. So it's a small study, it's kind of, we can't apply it to everywhere in the world, but it's an interesting sort of starting point to look between the links of between the two. We know with COVID-19, a lot of the signs and symptoms were really strange. So initially people were like, oh, I can't smell or taste things properly. I know people that had COVID-19 had ocular sort of symptoms, so conjunctivitis and these sorts of things. There have been some studies recently where people have manifested necrotizing gum diseases, so basically really nasty gum diseases, as one of the symptoms of COVID-19.
Really interesting.
And I think in general, the take-home message here is prevention. You know, if you can avoid having gum disease in the first place, see your hygienist, see your dentist, clean your teeth well, use interdental brushes, and just look after your general health. Don't sort of separate the two. Oral health and general health are linked.
Before I conclude though, I think one of the things that I often hear, and again I know the answer, I'm just doing my interview thing, is that people would say, oh, I have gum disease but it's genetic and you know it's not my fault. So what is your, kind of in a nutshell, the differences between genetics and environmental factors, how that's related to gum disease, and if you do suffer from anything, a genetic predisposition, how you can control that and what it means for you?
So yeah, if someone sort of claims hereditary, so maybe there was someone in their family who had gum disease, they're not actually wrong. Genetics plays a huge part in whether you do or do not suffer from gum disease. But ultimately, we can't change your genetics. So if you are one of the unfortunate people that is susceptible to gum disease, really all you can do is manage it in the best way that you can. So prevention, again, better than cure. See the dentist, see the hygienist, take their advice on board. Don't kind of resign yourself to saying, I am going to get gum disease. It is actually a very treatable condition in the right hands.
So if you've got the genetics, then there are options out there for you guys.
So many options. It doesn't need to be with a specialist. Every general dentist and hygienist and therapist are capable of diagnosing and initially treating gum disease. Very few people actually need, you know, significant treatment, and it's pretty preventable.
In summary, because I love my summaries, we know that the gums have a big impact on health in general. There's a lot of systemic diseases and gum disease that are linked together, but it's a preventable disease at large. Even if you have a genetic predisposition, you can be treated as well. There's a lot of interesting stuff going on about COVID and gums. Things are a bit inconclusive at the moment, but I think certainly we'll know some more later. This is my amazing gum specialist, Mitul. We will give you a cosmetic edition as well, but we wanted to cover health because that is the most important thing to start with. So don't forget to tune in next time, and we'll see you later.
Bye.